Benambra.
That's the one. Thanks, Acting Speaker. Now, I wish to raise a matter for the attention of the Minister for Health. The action I seek is for the Minister to provide an immediate solution to the crisis with beds and emergency presentations at Albury-Wodonga Health. Now, if that sounds familiar, it certainly should. It's the same question I asked in May, along with all the other correspondence, letters, emails that I've been putting through. Now, Minister, you blame COVID, albeit when you finally got around to replying 5 months later. People see through that, they call it for what it is, but I'm not permitted to be able to use that common language in this place. Now, in late October, you announced a stage plan to do a reno on the Albury campus. It will never be enough, and frankly does nothing for the present crisis. In the past 3 months, my office has been buried in horror stories, and I'll give you some examples. A 10-day wait to fix a broken arm, a 79-year-old stuck in the ambulance while her family desperately searched for hospital wards with ridiculous waits in emergency. The list is endless, but all these are being addressed by the Health Service, but still need to be raised here, and it's simply not good enough, Acting Speaker. Victoria is the worst state in the nation for health, the lowest level of available beds in public hospitals, fewer healthcare staff than all bar South Australia. Emergency waiting times way above the national average. Tell me what I say to an 83-year-old Jean Dudley who waited 7 hours to be seen in emergency after a fall at home. She fell 3 times in the day after being sent home with some pain pills, but told her son, "I'll never go back to that place." Wendy Hodgkin waited 3 hours with appendicitis. She couldn't be transferred for surgery from the Wodonga campus because there were no beds in the surgical wards over in Albury. Amy Carmody's daughter, Bailey, was also admitted for appendicitis. She spent 2 days in hospital fasting, promised and repeatedly deferred surgery. When she finally got to the table, the cause of the pain was found to be something completely different. Jess from Dartmouth suffered perianal abscesses in 2019. That led to complications and sepsis. There is surgery that will stop her repeated visits to emergency to treat the pain and the infections, but here we are in 23, 4 years later, and Jess is still waiting. Just got a call from the hospital last week just to see if she still needed the surgery. Now, I think they were just hoping that she'd paid for private health and the problem had all gone away. But no, Jess is still waiting for the backlog to clear. This is a Category 1 surgery. Seriously, you can't make this stuff up, and it just goes on and on. What do you think the stories will be like in the emergency department and the wards are construction zone for a part of the reno at Albury Base? Yes, you might reply and turn around and say New South Wales are involved in it, but it's simply not good enough for the border region of Albury-Wodonga.
The member for Mordialloc.
Thank you, Deputy Speaker. My adjournment this evening is the